and which disturbs me everywhere I go in this country, is why can't we have a proper benchmark when it comes to delivery of health services? The National Medical Stores is doing a good job. Drugs are delivered to the hospitals. But what happens to those drugs? And what mechanisms have you put to check theft of drugs from the hospital? Number two, we have recently, the problems of Soroti Referral Hospital are so widely spoken. In fact, they have given politicians a leeway to tarnish the names of government, while maybe government has tried its best. The first problem is when the machine, the X-ray machine was brought here, we were all very happy that the machine has come. Because when you go to that hospital, what you notice is that services are sourced from outside. The patient goes to the hospital, then shortly he has gone for scan someplace around the flying school. The hospital cannot provide that. The laboratory services, there are labs at the hospital, but many of those patients go to source the services outside. What is the relationship between those labs or those clinics and the hospital? Because that's where extortion is taking place. To the extent that now the machine, which was still new, had just been delivered, has just worked for 2 months and it cannot operate. So there is a problem in administration and supervision of those systems. The suggestion which I have is that let Soroti Referral Hospital have a new home. This old structure cannot help us. That idea of putting up a referral hospital at the university on a 50-acre land is a wonderful idea. Let government build a fresh referral hospital for Soroti people and for Teso, because this hospital is actually for the region. And the strength of that hospital should also be the strength of the university.
And it's part 20. I want to request my sister Honorable to read it.
It reads, the state shall take all practical measures to ensure the provision of basic medical services to the population.
Thank you. To start on with that, we should not be talking about water in the hospital. Because if we were working seriously, we'd be having a meterless water in the hospital. And all government institutions. Water is just in Abuja here, but you hear that 700 for what? A patient buying water. I think that one will not work. The other issues, when I got the letter from the State House that I want to present here is, let us decongest the hospital. There is Prince Diana, there are those health centers. Let us try to see that some patients are referred, like if you come from Kengeri Bonapes, you go to the health center. The other one is Dr. Podoi. Dr. Podoi has done a lot, but we just keep singing. We are discouraging him. We are not empowering him. Now this meeting like this is like, today we have had it. Another time we'll find after 2-4 years. What are we going to do to Dr. Podoi so that Dr. Podoi is empowered? Not just coming to talk, we hold microphones, NBS, and we are doing nothing. The other thing I want to add is VHTs. What has happened to VHTs? They are not paid their allowances. They go for meetings, nothing is done. But somebody must be seated on that money. The other one is pressure, first aid. First aid, basic things should be provided. The Constitution has just showed you. What can we provide like these cameras for ladies to deliver? First aid, drip, you have to pay. And there is one painful thing that annoys me so much. Referring patients to the clinics. Should have been the vice versa. Go and buy, yet I'm paying taxes. Refer me to the main hospital, not to the clinics. Something has to be done about that. The other thing is, you will even find when you go to the hospital there, you get stagnant water. Stagnant water, yet we are talking about mosquitoes. Mosquitoes can breed there and cause diseases. Why should we have stagnant water? Just a drip of manna. There shouldn't be anything like water around the hospital. The other request is, let us do something about the clinics. I'm not saying clinics are bad. Can you label your drugs so that when you're inspecting the hospital, the other color, the other side is not found this way? And if it is found, close the clinic. The other one is personnel. We need to help the personnel who leave before the time the others come to take over. They should be talked to. And we pray that after this, you don't sack our doctors and our personnel. Because you are supposed to give support supervision, not fault finding. Oh, Dr. Bodo so and so has done this. No, let us correct each other the way God is patient with us. The local population should be included in the monitoring team. Like after this, you go back to Kampala. What will happen after you? Can we have the ground root people who can oversee the ones who are with these patients daily? They are able to know what they are doing. After this, you check the planes, go back. What happens behind you, don't you? There are local people here who can oversee what happens. Witness leaves early. Then let us balance the ratio of doctors to patients. Even if we want to praise Dr. Podo like what? The wife is a doctor. Dr. Podo is a doctor. The home is left alone. He needs support. Let us balance the ratio so that the children can go and look at the mother can go and check on the children. The whole family is in the hospital. I'm sorry, I'm going to take a little bit short, long time, because you told me to come and present what allow me to present. No need for cost sharing, like you have given universal secondary education. We don't need to have patients pay anything.
One is one. Always government limits drugs. But I wonder why the drugs don't last for even 2 weeks. They are done. And I have a proposal. Thank you. I have a proposal as we are now moving towards enlarging a regional hospital. I pray that it should go storage because the region is too big and people fall sick all the time. I had that to add on what my previous speaker had submitted. I beg to submit.
When I reached here, I found rosy words about the hospital in Soroti. And they are rosy because they come from the word rose, which is a very good flower. I never had anything, but however, I want to add something onto that rosy things. That is let me put a nice rose. I have 2 doctors whom I don't know their names, but I know one. It's called Dr. Nyonga. We talk about doctors being very corrupt in this country. Dr. Nyonga in Diana, when he was there, I don't know whether he's still there, operated upon my daughter, never asked me even for a coin. When the baby was failing in Diana, she was supposed to be transferred to the main hospital. I didn't know where to get the ambulance from. Everybody is telling me, get this driver, and prepare 30,000 shillings. But somebody told me, call a certain doctor in charge of ambulances. I called that doctor. He doesn't know me and I don't know him. My daughter told me, when I was also communicating, I'm waiting for this doctor to tell me I'm sending for you an ambulance. Then my daughter calls me from Diana and said, there's an ambulance here. Could it be the one? I said, no, because I know man is involved. That one probably has come from somewhere, it's just passing there. Within 5 minutes, my daughter arrived at the hospital here. I was shocked. I didn't talk to the doctor much. I commend those two doctors. I don't know them. But Dr. Nyonga, I know him by name. I don't know him by appearance. Those are the rosy parts.
He's behind there. He's behind there, Dr. Nyonga.
Thank you, Dr. Nyonga. I'm the in charge of ambulance.
DHO.
Thank you very much. Now, I'm going to probably, when they say when you are traveling and there's a slope, be careful, there's a hill. This is where the hill is. I would like to ask you a question. Sorry for people who are going to be affected. I want to ask you that Kichinjati Health Center, is it supposed to work only on weekdays and on weekends they don't work? That problem is there, whether we want it or not. It even caused a problem between the administrators of that hospital and the previous RCC who left. Sometimes the key of the hospital is given to a watchman. He goes away with it to the village when there's nobody to hand over to. Dr. Watmore, your name is Rosie. Watmore means, according to my understanding, either a friend or a relative to the women. But the women are suffering in Kichinjali when it reaches the time when they are going there during the weekend, because when you have problems with the bus, it doesn't give you a day that I'll be on Monday, anytime. But you reach to Kichinjali, they tell you the hospital is closed. Put her in the border to come to the main. The main is full. Now, you will answer me that. What my brother, the former policeman, said, that we improve upon, or we build our hospital in the university, so that it becomes the regional hospital, I differ with that. That one should be a learning university where they can a lot of research from our place here to that place. It can be as big as Mulago, no problem. Mulago is also a learning hospital. But we need this hospital upgraded to a regional hospital. I know you're going to tell me it's a regional hospital. That one is theoretical upgrade, not practical. This is the worst hospital when it comes in terms of regional hospital. Go to Arua, Minister, you know. Go to Gulu, you know how powerful those hospitals are.
So
this one is
you can see the line.
Please, thank you.
My wife came here to deliver. She delivered, but the nurse denied her to pick the baby because she needed soap, jig, around 3 items. It prompted me to leave the village at 1 o'clock. I came, I went to town talks, I bought those things, and I delivered. The next morning, I went to the facility and I looked for the person in charge of the facility. When I talked to them, they explained to me that they have challenges in regards to G and those other things. And today, for us who are listening, we heard from the director, 633 million versus catchment area. I don't know when you translate to service delivery. I don't know what it calculates. So the team that has come from State House, it's not about coming here to entice us and you walk back. In terms of politics, I think we need to take it seriously. Secondly, I needed to see policymakers here because there are issues that deal with policy. When you are talking about the facility being small, the budget being small or meager, it needed the policymakers so that when they listen to us here, they should be able to go and advocate. We have approximately 41 members of parliament for the sub-region, but we are not benefiting anything from them as leaders. So we expect this. Two, in Soroti Regional Referral Hospital, there is what they call private wing and ordinary wing. As a member of Tax Justice Alliance Uganda, I don't know whether that money that is paid at the private sector on the private side is being taxed and who takes the money. So you should explain to us where that money goes. Just at the entrance when you enter, there is somebody who picks money for the motorcycles at 1,000 shillings. I have always rejected, and they have known me every time I go there. So if that money is being picked, who is the one in charge of that money? Can you take it to the city? Can the city now make it a business and generate money to the city? So we need to find out about it. And then the city scan. Members, on Wednesday, a friend called me. He needed to go for that CT scan check. The best place I would recommend it, because they told him from here the machine does not work. So you have to board from here up to Kiwambare. Very expensive, and that's a taxpayer. And I believe some of you who are seated there, you already have cards for going for treatment. Immediately you fall sick, you just get a card, you go and they test you, and you are okay. So members, as we are seated here, we are not happy, things are dilapidated. To NMS, we've had, I am also part of the village guy who monitors government facilities, most especially the lower local government health units. You can imagine, I want to give a scenario, NMS driving from Kampala to come and deliver condoms in a health facility. Then they go back. Then the village and the drugs. They are not drugs, these guys are selling drugs. So leaving the nurses and the community at the crossroad. That's why you need the policymakers. You needed to be assessed because you are one of the monitoring committee at the district level. It takes how many years for you to walk to the facility, tell the director, today we need to sit, there are issues that have come about the facility, and then you address. So we don't need to wait to come and see us, but you need to begin. That's why people are saying government is not performing. It is because there are a lot of loopholes that are not addressed. It is until these guys come when we are saying this. But Soroti Regional Referral Hospital, we want to thank you. Personally, I have interacted with you. Doctors in Soroti now, you don't pay money. You go and get the services, but they are constrained. So we expect a feedback from the State House. You needed to be assessed because you are one of the monitoring committee at the district level. It takes how many years for you to walk to the facility, tell the director, today we need to sit, there are issues that have come about the facility, and then you address. So we don't need to wait to come and see us, but you need to begin. That's why people are saying government is not performing. It is because there are a lot of loopholes that are not addressed. It is until these guys come when we are saying this. But Soroti Regional Referral Hospital, we want to thank you. Personally, I have interacted with you. Doctors in Soroti now, you don't pay money. You go and get the services, but they are constrained. So we expect a feedback from the State House.
An address. In fact, for me, I would like to second somebody's argument who was here. One thing that I have observed in our hospital here is the staffing. In fact, if you are a nurse in that hospital, you will also bear witness with me. I have ever gone there because sometimes I fall sick, but you find the population is there, which is there is like a market. These people are overwhelmed with the population from morning up to a certain hour, standing and maybe waiting. There's no time to rest. I want to urge government. Institutions are training doctors, training nurses. What is the government doing really to recruit more staff to these people? Just like it was mentioned from here that the hospital needs about 500 workers, but only 200 are being employed there. Many children, our children, are floating outside there. What is government really doing to add this population so that services are given in an even way? I also want to urge the doctors
Because of what you have, I don't know whether you also give reports so that they respond to. But we are elected this day that our state house is here. Would you please take this complaint?
So, what is your RBC? I have anything that I know. No, I think I can to the Kotia. And Jokoti. Now, Kromi never had a less Kotia. So, I can't want a solid. I gather one OPD. I'm going to OPD. No, Sido, no, we don't take it. When you saw a doctor, what get less than your own, police will get you doctor. You know, it is a one. But they can't go in, they can't go in. What can is a plan? When I get okay, you will kill your baby. Whatever. Kill your baby back in. About a Otokiana. In general, a parable. I bet I'm going. What do you now? You know now that I will see it every working job, we work it I say this. I don't like I buy. You are not applying back away. I'm working about or plan to say job. So you know now you are kidding now, never know about a party for the polo. What you care. But not a game. You saw what you obey. No quality came or Lisa. You know, Lisa now. Then, okay, you put out a report and the animal. They just sit pro, get a parallel. Look at it, go good at that. You tell me. That's what you're saying. Now, you're the king. You go about your account command playing work. RCC. I would assume I'll look around Monanari. Algo sana Pugan. Yoro regional to Amuna. No de lo que UTI Bakabe Urukina. UTI Bakabe Maka Alskin. Then Maka MP, they go. Bakatina. We get to the Abue. Atumani Kamana Kede, Atugan. Arasis. One very Atumani. You go on to maternity. The Jackson Commander, the Toro City, the Lemon, the Lemon Sigin, and the Incomparative. And I'm even Sigin, what have you, and I will be Kapu, the master. So, Alexander, and I because we just say, no, I'm not being open. One that you want to wear.
In Cote Kirola, sitting at the Tuaka police, and their police in it, you would pass on your police.
I put my back in a washer, RCC. Actually, when I go there, I was separated to it. I don't want. You go there, you know, each child. If you carry a plane, I do carry, I was having a key, and I don't make it. Now, you're making a valid to one. It was more like poor. Now, when you give me, it is like you could in the Penadeka. This is more quarters at the case. It is some Pugan. I take his so I can young, never said a case, because I case. What's a little bit? You are not at a case. Let's
look up your Christine. And I'm a member of a Pajaro Town Alepane. Now, so the good I shall am in Dr. Podoi, can Dr. Nyonga, Yalama Pusiswam. Can I not see you and let you know Suban? To show me this lap of said job. Konya just walk at a gradis na kutonga limu. Na solid elosine jana sinisiloeti tunga. Ilosi nikota ya unu ni kwa kukinga. Ingisa ya biko kema saini. Dite mage bako ina domene. Kutu kuleja eloto nuori. Ini elasa elote dikosi kilo. Nga bebe sa isilo. Odaya kisi saa ule basole chamla suba na uo. Mapana kauti luni. Mamara benga koto. Konya just walk at a break like your can. If we don't do that, you can't put out from where we can put it out in the way. You get us out and have a JCO. He had a guinea, a word in a back of a sugar lady diabetes. A year money and you are carrying. A banana to generalize a man or serious. About first give me 5,000. I don't want to get 5,000 testing a diabetes, family some making of them. Now, who need care? I'm a little not at the Saki cotton. Very lost at the case. You know, I don't ask you for your ticket up. If I first sit and wait, I'm doing it bad, I want you to attend me. She's first in TikTok and I'm on Facebook. I would like to get messages or don't get. What is your problem? My problem is you. Because I've waited, you told me to sit and wait for you. I will sit and again you come and ask me what is your problem. So I answered her, my problem is you. So I don't get me photos and Elbana. Inya mesula suban. Konyonya sadekis. Also de losina neja siklina suladekis. Inga chacha beru kede dabada. Ite jula sipoki nga brodele ngaka kwanti pake unaranga kuwa ikape. Ijuka kipi. You extend, you a cleaner, but you're shouting at me. Sorry, may God bless you.
So they did that according to government plan. Reach the time of delivery. My wife is supposed to deliver at around 10 in the evening. It reaches up to around 5 when she's in a critical condition to die. Do you know what the doctor told me? Doctor said, you most likely to lose the woman or the child. If not the child, it's the woman. Otherwise, both of them are in a critical condition. Why? The delay of the doctors who are working at night, there was no doctor that day, even a single doctor. Midwife who was there, I paid money for the facilities needed there, and she told me that if your child died, don't blame me. Where is the problem? It is the government. They are not monitoring what is happening in the hospital. The doctor who came to operate my wife, I got through God and friendship, but not from the resident where I am staying and where they have deployed the doctors to come and help me. A friend from Kampala, Molago, is the one who connected me to the doctor who was off duty. When that man came in at around 5, he told me that. Then he said, if the child died, don't blame me. I'm off duty, but I'm just coming here to help you as a friend. Look at that scenario, and it is a government work. I really feel it so bad.
Yeah. Asante nga shalam kine upa. Itunga leba jeni okesi mun. Opointi pana. Akotonga ni mun bonde. Ikosi muro koke na kosa nasi. Iyala maso. Konya pugana lope. Amena itekero waike. Anunya nera ni wapain. Apakia lo singa dekis. Namas. Tidai kwa kitichebo deni na. Oje bele ni ose. Ake polo bonde. Iboroti wa puka. Oje asa nwa puka na ni no ya piete. Iloto banana gona ni kina kwesi bonde. Baba ingai be ingai. Esu apuka na koto ngai lipe su liponto so pisa na da polo. Ingara kisisa ingara kini bonde. Ebo siti kwa. Nesi bona lo sina limoki nesu. Anunya nera ni wapain. Kopo kanja lo sak anekis ba chuman. Eba kabe do kita bengai be do kita ngai mame do kita do saya una machine reke do mama na ste do saya una tabo yuadika reke ini mara puga ngese beta son ya lama